what I'm going to present on is a recommendation for the creation of food and health access school hubs, taking COVID-19 as an opportunity for social innovation. So my immediate goal today is to enlist the help of an organization, Independence Blue Cross, Bill Abundance, to propose the creation of and to work with a state government task force that I envision led by Dr. Rachel Levine and Pedro Rivera, the Secretary of Health and Education for the Commonwealth of Pennsylvania, to create and implement FASH, food and health access school hubs. Access to food and healthcare, we've known they are determinant factors in social development and improvement, because better food and health translate into better educational outcomes, and in the end, into a better society. And the US has created over the last 150 years several programs of hygiene and food assistance in public schools that have carried the nation through several crises, including the Depression, the post-war years. The present crisis is COVID-19, which has caused school closings, business closings, resulting in loss of access to food and health services for a large portion of the population. If we look at the numbers, we really understand the dire need. The National School Lunch Program served over 37 million American children while schools were open in the first 3 months of 2020. And there are now about 2 million new unemployment benefit claims that have been filed solely in Pennsylvania for between March 15 and May 27, yesterday. Yesterday, we also passed the 100,000 mark for deaths from COVID. Even if many more are recovering, have recovered, those are actually the people we need to focus on. And we have to ask ourselves how many will be left with long-term health problems as aftermath of COVID-19, even children, because now we know that it affects children much more seriously than previously expected. So my solution would be the creation of food and health access school hubs, using children's enrollment in public schools to identify family in need and provide for these families food and healthcare access. And this can be done regardless of how instruction will start up again in the fall. The services provided at the FASH would be food packages for the whole family through a combination of the National School Lunch Program and SNAP, but also in collaboration with local food banks, food distributors, and foundations, and also basic health services for students and their families based on the retail clinic model, in collaboration with local healthcare providers and foundations, educational and health foundations, but also Comcast, for example, which could assist with creating telemedicine platforms and providing hardware and internet services. When we think about this kind of programs, we certainly have privacy and security concerns that must be addressed. And we can therefore think about separate points of entry, about requiring specially issued school IDs for access to services. We can provide services at different times than outside of school hours, and offer telemedicine services. My recommendation in summary would be identify communities and schools to implement pilot FASH, fund from existing federal, state, municipal programs and private organizations, collaborate with local food banks and food distributors, healthcare providers and foundations, and simplify the application process and access to food and health services so that we can guarantee the well-being of children, their families, and really of the whole Commonwealth. So thank you for your attention. I look forward to your questions, and I can be reached also at my email, johnston@sas.upenn.edu.